Hello dear friend. Today we will let us know about alpha-thalassemia and will cover types of alpha-thalassemia and signs and symptoms associated with each type of alpha-thalassemia, diagnosis, treatment, and last bonus tip. Alpha-thalassemia, a comprehensive guide. Introduction. Alpha-thalassemia is a genetic blood disorder that affects the production of hemoglobin, the protein in red blood cells that carries oxygen throughout the body, leading to reduced levels of hemoglobin in red blood cells and anemia. The severity of the condition depends on the number of affected alpha-globin genes. It is caused by mutations in the HBA1 and HBA2 genes, which provide instructions for making alpha-globin chains. Alpha-thalassemia is caused by mutations in one or more of the 4 alpha-globin genes located on chromosome 16. It is important to note that the severity of alpha-thalassemia can vary depending on the number and type of gene mutations, as well as other genetic and environmental factors. The signs and symptoms associated with each type of alpha-thalassemia may also vary among individuals. It is recommended that individuals with a family history of alpha-thalassemia or who are at high risk for the disorder undergo genetic counseling and testing to determine their carrier status and potential risk for passing the mutation to their children. Types of alpha-thalassemia, and signs and symptoms associated with each type of alpha-thalassemia. There are 4 types of alpha-thalassemia, each with varying degrees of severity. These types are based on how many of the 4 alpha-globin genes are affected by mutations. Silent carrier. In this type, one alpha-globin gene is missing or non-functional. People with silent carrier alpha-thalassemia usually have no symptoms and can pass the gene mutation on to their children. Alpha-thalassemia trait. In this type, 2 alpha-globin genes are missing or non-functional. People with alpha-thalassemia trait may have mild anemia, fatigue, and other symptoms, but they can usually lead normal lives. Hemoglobin H disease. In this type, 3 alpha-globin genes are missing or non-functional. People with hemoglobin H disease may have moderate to severe anemia, jaundice, and an enlarged spleen. Treatment may include blood transfusions, folic acid supplements, and in some cases, splenectomy. Alpha-thalassemia major sad phase, hydrops fetalis. In this type, all 4 alpha-globin genes are missing or non-functional. This is a severe form of the disorder that can be life-threatening. Infants with alpha-thalassemia major are usually born with hydrops fetalis, a condition in which fluid accumulates in the body and can cause severe swelling, breathing difficulties, and other problems. Treatment may include blood transfusions, bone marrow transplantation, and supportive care. Signs and symptoms. Fatigue, due to the lack of oxygen carrying red blood cells. Pale skin, due to low hemoglobin levels. Shortness of breath, due to low oxygen levels. Delayed growth and development, due to chronic anemia. Enlarged spleen, due to the overproduction of immature red blood cells. Jaundice, due to the breakdown of red blood cells. Bone deformities, due to the expansion of bone marrow. Diagnosis. Diagnosis of alpha-thalassemia typically involves a combination of blood tests, DNA analysis, family history, prenatal testing, and sometimes HPLC, high-performance liquid chromatography, method. Blood tests. A complete blood count, CBC, may be ordered to determine if a person has anemia and what type of anemia they have. Individuals with alpha-thalassemia may have small, pale red blood cells and fewer red blood cells. Hemoglobin electrophoresis is another blood test that can help identify the type of hemoglobin present in the blood. Individuals with alpha-thalassemia may have abnormal hemoglobin patterns. DNA analysis. This is a type of genetic test that can identify mutations in the HBA1 and HBA2 genes associated with alpha-thalassemia. DNA analysis can determine carrier status, as well as the severity and type of alpha-thalassemia. It can also help diagnose alpha-thalassemia in fetuses during prenatal testing. Family history. A family history of alpha-thalassemia or other blood disorders may suggest a higher risk for the disorder. If one or both parents are carriers of alpha-thalassemia, their children have an increased risk of inheriting the condition. Prenatal testing. Prenatal testing is available to determine if a fetus has alpha-thalassemia. Methods include chorionic villus sampling, CVS, and amniocentesis. CVS involves removing a small sample of tissue from the placenta, while amniocentesis involves removing a small amount of fluid from the amniotic sac. These samples can be analyzed for genetic mutations associated with alpha-thalassemia. HPLC method. HPLC is a method used to separate and identify different types of hemoglobin in the blood. This method is used to detect and diagnose hemoglobin disorders, including alpha-thalassemia. HPLC can identify abnormal hemoglobin patterns and help determine the type and severity of the disorder. It is important to note that diagnosis of alpha thalassemia should only be made by a qualified healthcare professional, and genetic counseling may be recommended for individuals and families affected by the disorder. Treatment. The treatment for alpha thalassemia depends on the severity of the condition and the symptoms that the person experiences. There are several treatment options available, including blood transfusions. Individuals with severe alpha thalassemia may require regular blood transfusions to replace the deficient or abnormal red blood cells. Blood transfusions can help alleviate anemia and improve quality of life. However, frequent blood transfusions can also lead to iron overload, which can cause damage to organs such as the liver, heart, and pancreas. Folic acid supplements. Folic acid supplements are commonly prescribed for individuals with alpha thalassemia. Folic acid is a type of B vitamin that is essential for the production of red blood cells. Individuals with alpha thalassemia may have increased folic acid needs due to increased red blood cell turnover. Bone marrow transplant. A bone marrow transplant may be recommended for individuals with severe alpha thalassemia who do not respond to other treatments. A bone marrow transplant involves replacing the defective bone marrow cells with healthy ones from a donor. This procedure can be risky and requires a suitable donor match. Iron chelation therapy. Iron chelation therapy is used to manage iron overload in individuals who receive frequent blood transfusions. This therapy involves using medications to remove excess iron from the body. This can help prevent organ damage and other complications associated with iron overload. It is important to note that treatment for alpha thalassemia should be individualized based on the person's age, overall health, and the severity of their condition. In addition, genetic counseling may be recommended for individuals and families affected by alpha thalassemia to help them understand the risks and available treatment options. Overall, with proper management and treatment, individuals with alpha thalassemia can lead healthy, fulfilling lives. It is important to work closely with a healthcare provider to develop a personalized treatment plan and take steps to manage the condition and prevent complications. Thank you for watching. Please subscribe and like the channel to encourage us to make more such videos.